Share screen 3 times.
Yeah. Okay, so we should be live now. So, hi everyone, I'm Charlotte from Healthwatch Bury, and today we're going to be doing our live around the bowel cancer awareness and having a session around this. So, a few live stream guidelines. We want to be accepting. Everyone is welcome regardless of race, ethnicity, national origin, religious affiliation, sexual orientation, sex, gender identity or ability. We want to respect boundaries. We don't want to make advances or comments that on appearance that might make people feel uncomfortable. And we don't want to be rude. We don't want to intentionally provoke, threaten or insult anybody. We don't want to flood the chat. We want to keep the conversation going, but we don't want to repeatedly send the same message because then other comments can sometimes get lost. And we're not here to self-promote, so we want to keep it focused on the topic of the stream, please. And we'd like to keep it clean, so no shocking, obscene, vulgar or inflammatory language. So today I'm doing a brief introduction and then we're going to be passing over to our guest speakers that are with Bowel Cancer Awareness, Hannah and Alison. And then we've got Ian that's going to be speaking. Oh, then we've got bowel screening lead. And then we've got some lived experience of our lovely guest Ian. And then Steph will be taking over as usual with the questions and answers. So Healthwatch is your local health and social care champion. We make sure your NHS leaders and other decision makers hear your voice and use your feedback to improve care. We'll listen to your experiences of using health and social care services and share them with those with the power to make change happen. And we can also provide you with information and advice. So we can support you by signposting to local or online support groups. We can give you information and advice about you or your family members' healthcare, and we can listen to your experiences of using health and care services within the Bury area. So here's our contact details that I'll just leave up there for a minute. And then I'm just going to stop sharing my screen and I will pass over. Yeah.
Hello, I'm Alison Chapman, Cancer Care Coordinator.
And I'm Hannah Dixon, the Cancer Care Coordinator, both Cancer Care Coordinators at Horizon PCN in Bury.
Okay, we're going to talk to you about bowel cancer awareness. Okay. Sorry, just one moment, technical issue. Okay, so bowel cancer starts in the large bowel or colon and the back passage or the rectum. It's also known as colorectal cancer. The most common cancers are breast, prostate and lung. Bowel cancer is the fourth most common cancer. The most common cancer is lung cancer, and bowel is second. A family history gives you a higher risk of getting the disease. However, no family history of bowel cancer only puts you at average risk. Factors such as age, diet and lifestyle mean that you are at the same average risk, just like everybody else. No symptoms. Just because you can't see blood in your poo, for example, doesn't mean that the disease isn't there. We see many patients who may have had a few or a lot of symptoms and patients who don't have any. 98% of bowel cancer patients can be cured if caught at stage 1, compared to 44% diagnosed at stage 4. Treatment depends on where the cancer starts in your bowel and how early the cancer is found.
So common symptoms of bowel cancer include bleeding from the bottom or in the poo, on the toilet paper after wiping, a change in toilet habits such as not being able to poo, constipation or having loose poo, diarrhea, unexplained weight loss, being very tired without any reason, a pain or lump in the tummy. As mentioned earlier, patients may have all these symptoms or none at all. Nova is going to talk more about the screening programme, which is able to pick up small signs of bowel cancer. Following this, we are then going to hear from Ian Walsh, who has lived experience of bowel cancer.
Thank you very much. So my name is Nova Martin. I'm the Cancer Screen Improvement Lead for the bowel cancer screening programme. So my job is to work with community and engage primary care in making sure that they are educating and empowering their patients to attend the screening. So bowel cancer screening programme is one of 3 cancer screening programmes in the country, the other 2 being cervical and breast cancer. The aim of the bowel cancer screening programme is to detect bowel cancer at the earliest stage possible. So it is patients with no symptoms. That said, we do get a lot of people through with symptoms. It is a taboo subject. It is something that people don't always want to talk about or go to their GP about if they've got problems with their tummy or going to the toilet. They don't want to talk about poo and things like that. So we do find that when our nurses are assessing the patients, maybe after having a positive or an abnormal test, they do discuss symptoms that they have been experiencing for some time. So everyone within the England is eligible for a screening kit, and that is from they have to be registered with a GP, which of course there are people out there that aren't registered with a GP, but people who are registered with a GP, historically it was from 60 up to 74 years old, and we recently last year dropped that to 56. It is actually being dropped to 54 imminently, and as of next year it will drop all the way to 50. The reason for that has been that they have noticed that the prevalence in that 50 to 60 age group has risen. So obviously the idea is that they will screen more people at an earlier stage. And as it says there, the kit is sent every 2 years automatically as soon as you get to that age. If you're 74, it doesn't mean that you have to stop doing your kit. It just means that you have to opt in yourself. So what that means is you would ring or email the central hub and say, look, I still want to keep getting it every 2 years, and they will do that for you. Age extension, I think I've just mentioned, means that we are dropping the age range gradually. And I think actually in the Bury area, we are now screening 54-year-olds. So it's as you become 54, you should expect a letter from our screening hub, which is a central hub that covers the northwest of the country. And then a couple of weeks later, they will send you the kit. And the kit itself just fits through your letterbox. There's a picture there. I've got one here. It's basically a little cardboard box, and in there you have leaflets, you have envelopes to send the kit back. All the information is available in there, and there's a lot more accessible information online as well. So if there is any reason you would like to watch a video, or you would like to see information resources in different languages, they're all available. And the screening hub can actually send information in different languages. They can send braille information out if it's needed. So the kit comes through the door, and it is your choice. It is a screening, so it is completely your choice. But what we would like people to do is actually complete the kit. It is the only screening program that you actually do the test yourself at home. That is a good thing for many, but unfortunately it can also cause some hindrance and some obstacles for certain people. So what the fit test actually does, it's like a little tiny mascara, and it has a little wand in it. And what you would have to do is actually catch a sample of your poo, and how you do that is up to you. We've had people cram their toilet so full with tissue paper. We've had people put little plastic containers in, perhaps what you use your takeaways for. We've even had a gentleman who used his pet's litter tray. So there's lots of ways to catch your poo. I wouldn't suggest that one, but hey. And what happens is you just do a tiny scraping just to cover the actual ridges on the wand, put that back in, and then it's an envelope that it goes in an envelope, and then a further envelope, and it goes in a post back to the central lab down in Rugby. You'll get a result from that within 2 weeks, and 98% of people who send these kits back actually get a normal result back. And the outcome of that will be that they will get another kit in 2 years' time, and it will go on and go on. 2% of people do get a letter back to say that they've actually found blood in the sample, because that's actually all they're trying to do is look for blood. And if it's over a certain threshold, that's classed as an abnormal sample. Following on from an abnormal result, you would get invited to come in for further investigation. Most people, that means a colonoscopy, so that's a camera investigation. Some people who aren't able to have colonoscopy may well be invited for what we call a CTC, which is a colonic CT scan. And that will obviously be an X-ray of the bowel just to see if there's anything that's causing. So about 90% of people who actually come in for a colonoscopy or a CTC are not found to have any cancer cells at all. There's no reason, there's no cancer reason why they've got bleeding coming from that area of the body. However, it is flagging up with people, obviously, that they may have other conditions. They may have diverticular disease, they may have hemorrhoids, piles, those kind of things. So it's useful, obviously, if you didn't know already, to find out that you've got those that information, and the nurses will signpost you for that. We have a good team of specialist nurses, specialist screening practitioners, and what they do is they support the patient right the way through from a positive fit, the way through to whatever their diagnosis is, if indeed they do have any diagnosis. So that's basically the screening program in a nutshell. Thanks very much. I'm happy to take any questions at the end or whenever. Thank you.
Oh, thank you very much for that. That was very fancy. That is a presentation with your bullet points just coming out, guys. I'll give you that. Before we go to Steph and her Q&A, can we just go over to Ian, is it, for his story?
Yeah, I'm here. My story, yes.
Oh, your life story, your experience.
Yeah, part of it. Yes, I mean, to be fair, before I was diagnosed with bowel cancer, I probably knew very little, didn't even think about it, hadn't read about it, didn't know the symptoms, didn't know anything about it, because just like many people, I didn't think something like that would happen to me. So it was around about 2015 when I was diagnosed with the bowel cancer. And the interestingest thing is actually how I came to be diagnosed. To cut a long story short, it's a good news story, because I was very fortunate to be diagnosed with stage 1 bowel cancer. I didn't need any further treatment, and I was in that percentage of the ones who would have the best chance of survival. But I'm very conscious that very few people actually get diagnosed with stage 1. I think it's less than 20% of the people who are diagnosed with bowel cancer actually have stage 1. Most people, it's much further along, it's much more developed. Hence why bowel cancer is the second biggest killer of the cancers. So I suppose for me, and following on from the presentation, is how was I that lucky then? What did I do? And it wasn't, I'm not going to sit here and say it was by good management. I'll say it was actually pure good luck, because, and I think it's a case of getting to your GP, going to the doctor and being truthful with your doctor as soon as possible. Now, I'm no big saint, and that wasn't me when I first started this. What started happening with me, I wasn't ill, I was going to work, I wasn't in any discomfort or anything, and all it was a kind of subtle change in my bowel habits. I used to have a routine where I would get up, have a cup of tea, go to the toilet, and then go to work. And that was me for years and years and years. And then it was just a subtle change of, I would still get up, have a cup of tea, go for a poo, and then go to work. But then it was, when I got to work, I needed to go for another poo. And it was a bit looser, but then that was it for the day, then nothing else. And that became my usual pattern. That became my new bowel habit. And I thought nothing more about it. But again, that started to change, not suddenly, but over time. By the time I was getting to work, it was becoming more urgent for when I wanted to go to the toilet. So I wasn't telling anybody this. It was just something which I thought, this is what happens. Maybe it was stress. Maybe it was what I've been eating. Maybe it was because I've had a beer. Anything. I'd make up in my own head loads of reasons why this wasn't out of the ordinary. But I must have known something wasn't quite right, because I do what most people do. I went to Dr. Google and I started diagnosing myself. And obviously you come across lots of different things, and as been mentioned, there's loads of things that can cause different things, and blood. I couldn't say any blood in me poo or anything like that. So in my little head, I was quite happy that there was nothing the matter. But deep down, I knew there was, but I didn't think there was a need to go to the doctor. So that continued for a while, but the urgency of going to the toilet the second time increased. But again, as I said, once I'd been the second time, that was it. I didn't need to go to the toilet again, so I wasn't bothered. But I had started to look into the bowl afterwards just to see if there was any blood. And at one point I saw something red in one of the stools. And as I'd always done, I made up an excuse for it. I said it was a tomato. I said it was a pepper. I said it was anything. I said it were piles. I said it was all sorts of things. And then it didn't happen the next time. So I thought, oh, cured. You know, it was just a one-off. And it did happen again. And we're talking here only over a period of about 6 months, I think, at most, probably a bit less. And my first stroke of luck was that it was while at work. I'd been to the toilet the second time, and I had started thinking a bit more about it. And I thought I'd go to the doctors. And I think I'd started to, I thought I had like indigestion or something like that. And I was just holding my stomach, and somebody said, "What's the matter with you?" I said, "Oh, just a bit of indigestion, I think." And they said, "Well, what is it happening often?" And I said, "Yeah." "Well, ring the doctor then." "Oh, yeah, I will. And it was a case of, well, I'll ring a bit later. I said, "Go on then." And stood there while I just rang the doctor, and I made an appointment. And that's how I got to get to the doctor. But again, getting to the doctors, that was just step one, as I found out, because I know a lot of people do get the doctors, but then again, sometimes they're maybe not as truthful with the symptoms as they could be. And I wasn't that comfortable about talking about my nether regions or anything like that, about poo. I also knew that with the area I was talking about, the examination mightn't be too comfortable, so I wasn't really looking forward to that. But anyway, I went and I explained all my symptoms, and the doctor just said, "Well, you can have Bescapan," I think is what it's called, for a couple of weeks, and then if nothing changes, we'll book you in for a colonoscopy, which I didn't really know what it was, a colonoscopy. But I said, "Well, can you not just book us in? And then if it works, I can cancel rather than the other way around." And thankfully, he agreed. And so that's how it came about, that I got to go for the colonoscopy. In between that, I then started reading about bowel cancer, which I thought then there was a possibility it could be. And when you start reading about it and your chances of survival, it starts to get a bit scary. And that's when the worry starts kicking in. If it is, if it isn't, and so on. And I think that's where the stress started to come in. That's where, if you want to call it, the battle against cancer would be. And I think it would be the same for lots of other cancer sufferers of all of the other different cancers. So having the colonoscopy, which drinking the solution was the hardest bit, 2 litres of some horrible, which you convince yourself is nice on the first sip, but after you go on in your 4th pint, you think, and this isn't as nice as you think there. So the colonoscopy, again, when you watch it on the television, I realised when the surgeon came across it, and the conversations behind us changed, that all wasn't well. And when it came out, and just hearing those words of, he never said bowel cancer, he used the medical term, but he knew what it was, and that involve an operation and we need to check your liver and your lungs and so on, because at that point that you're not told whether or not you've got stage 1 or stage 4. So obviously I thought I had stage 4, and so when he told us that, I thought in my head that was it. So everything, my job, my plans, whatever, that was the end of it. You know, I would definitely have stage 4. I was probably going to die because that's the odds. That's what happens. And if not, I could have a colostomy bag. If nothing else, then I'm going to have a series of chemo and radio. And lying in the bed, just being told that without going through your head was really, really difficult. And the other thing which was really, really difficult is telling people, telling your family, telling everyone that you've been diagnosed with cancer. Because I think when somebody tells you that, how you react to that is very difficult. What you're supposed to say, you're going to be all right, or my Uncle Billy had it, now he's climbing Mount Everest and all that and all that. But deep down, you don't know what to say. So it was very difficult, that bit, and just knowing that. But then you're on this conveyor belt, and I think everything happens very quickly. And the care that is given, for me personally, I thought was absolutely brilliant. You know, that they explain what's going on. The trouble is, it happened so quick. I wasn't ill. That was the funny thing about it. I just wasn't ill, and I knew I had to have this operation. And I did have the operation. I was worried to death about having to have a colostomy bag. Fortunately for me, that didn't transpire. I didn't need one. And once I got back home, it was a 2-week wait while they did the biopsy on the tissue that had been taken out. And I just got a phone call at home, and I was just told that the good news is that I had stage 1 and would require no further treatment. And they'd see me in clinic in about 6 weeks. So in the space of really 4 weeks, I'd gone from thinking I was going to die, thinking that it wasn't going to be very nice, and whatever was going to happen, to being told, no, you're not, you're all right. And that was weird. And I would have thought I would have been quite pleased and happy about it. But I wasn't. I was kind of drained, and that stuck with me for quite a while as well. And further on, as I went through, I started to get feelings of guilt that I was one of the few who happened to have stage 1, where a lot of people don't get that, people much younger than me. And again, I was just very, very fortunate for that to be my case. The other part of the bowel cancer, apart from that, I'd been cured, it had been cut out, and major surgery was a shock. I didn't realise how bad that was. And the recovery from major surgery was a big grim. But also, which I didn't realise, is that if you have part of your bowel taken away, you've got to learn to poo again. And that came as a bit of a surprise, because the literature is quite matter of fact, but it doesn't describe the reality, where it was going through weeks and weeks of going to the toilet about 6, 7, 8, 10 times a day, going to the toilet, sitting down, getting up, wanting to go straight to the toilet again, terrible wind. Then you lose your sense of security. You don't want to go out because you don't want to be too far away from the toilet. You're worried about having accidents and all that. And that goes on for quite a long time, depending on different people, different times. But again, that part, even though it was stage 1, that was a very difficult period of the bowel cancer and living with that. But you know, there's the different organisations like the Macmillan. My cancer nurse from the hospital was really, really good, because any time when I had any concerns, I was always able to ring up, and then she would be able to tell me about things and reassure me if I had any, because I was frightened to death of it coming back. I was frightened to death of them being wrong that it was stage 1. Any cough, I thought it had gone to my lungs, and anything like that, any backache, I thought it had gone everywhere else. So just having the reassurance from other professionals was really good and important. And also different charities and meeting other people who've had the experience, had the experience, because you get some people. Well, for me, I'm quite comfortable talking about it. Some people are not comfortable talking about it, but I found it really useful, because I realized that the symptoms I was having, or not the symptoms, but the impact of it, it wasn't unusual. It wasn't different. Other people were going through very similar things like that. And being able to talk about it and listen to other people's stories about it was really useful. And again, going back to on the plus side, I suppose, since I've had that, the people who I know, they are very keen on their bowel movements now. They do make sure that they check. All my friends are of the age where they get the kits to test. They make sure that they do do the tests. I must say, I wasn't part of that. I wasn't old enough for the screening tests, but so that's why to look after your own symptoms, to look for your own symptoms is important. But I do try and encourage everybody now to think about that area, and because pooing is not something that you talk about really. When something goes wrong down there, you don't come out of the toilet and tell everybody assembled in your house, say, "Oh dear me, you never guess what's just happened to me." You just don't talk about it. Instead, you can tend to worry about it. So overall, my experience, yes, it was an experience. I'm very fortunate that I was stage 1. Has it changed me? It has, because it's led me to have a much healthier lifestyle, from the food I eat, exercises that I take, because I want to reduce the risk of that happening again, because I'm aware that it could happen again. So I hope that's useful. Obviously, you can ask us any questions and things like that. And as I say, I don't mind yabbing on about it at any time.
Ian, that was real. Thank you so much for that. Honestly, there's just so much information that you've thrown that I wouldn't have even thought about. Like, I thought it was really impressive that you get them through the post full stop when the ladies were speaking, but the things that you're saying, like you make excuses, don't you? And it can be really subtle sort of changes. And obviously you do need to be very vigilant looking after your own health, but it's brilliant that you spreading awareness the way that you are doing, because obviously, like you said, it wasn't comfortable to talk about at first. So it's only through doing it that you're so out there now, isn't it? Which is really good, because it's making all the difference. But on that note, I will pass over to Steph, who I think has got some questions for you.
Hi everyone, and thank you for sharing all your information. Thank you to Ian and the lady who talks about the bowel screening, and obviously Alison and Hannah. It was really good information. You've actually answered all the questions that I had planned, but I would just like to ask a few questions, if I may. Firstly, about the lady who talked about the screening. Apologies, I've forgotten your name. But you talked about the certain people who struggle with the bowel cancer kits for obvious reasons. They may have disability or whatever, or other health condition where they can't manage to do the bowel screening themselves. So is there any alternatives out there to make it easier for them sort of people?
Thanks, Steph. Yeah, it's Nova. I'm not aware, unfortunately, because the screening, bowel cancer screening is a national programme, so it's done in the same way across the whole country. But you're absolutely right. There's a large proportion of people where health inequalities are apparent, and there lots and lots of different reasons. There can be patients who speak a different language, they read different language, they aren't able, perhaps they haven't got the dexterity to do the kit, because it is quite small. It's smaller than your average mascara and that kind of thing. There has been talk of adjustments being made and things like guides being made to attach to the kit. So as when you're putting the wand back in, for instance, you know, it's not such a tiny little hole you've got to get it in. What we do as part of our role, the Cancer Screening Improvement Leads across the area, is we try and engage with community leaders or the key people in different pockets of society. So, for instance, we work very heavily with carer organisations, with learning disability teams, community nurses. We cover obviously all secure units as well, so prisons and things like that, the secure mental health institutions and not institutions, units. So we try and engage the people who are there to support the patient and make sure that they are educated and equipped and have the information that they need to support the patient through the process. It's important to say that bowel screening is not for everyone. There are going to be some people who either can't do it, and if you imagine that the fit kit is just the start of it, and then if like Ian, obviously I know Ian, you didn't do it through screening as such, but if you do need a procedure, a colonoscopy procedure, which is obviously quite invasive, you're in a clinic of theatre situation almost, you have to take bowel preparation, which Ian talked about, which is you know, a week of eating a low residue diet. You've got to take preparations that literally mean that you are, you know, chained to your bathroom for 24 hours. There's people out there that can't do that. So what our nurses do is they assess whether or not this is a feasible investigation or not. And also there's a large proportion of people who it would not benefit them even if we found that there was an issue. And that sounds really awful and really sad, but actually we have to have the best interest of the patient at heart at all times. So it is sad. There are some people, I'm not aware, there's things happening out in research all the time. And I'm not aware of there being another way to test, to do the feces test, if you like, the fit testing. However, there are new investigations in colonoscopy being done, and there's actually a colon camera that is being used and tested. So instead of having to have a camera up through into your large colon through your rectum and so on, they are testing, I know in London, with a camera that the patient swallows, and it goes obviously all the way through the stomach and the small bowel and then into the large bowel. But obviously that's testing phase. But unfortunately, Ian, you still have to prep for that. You've still got to get it nice and clean in there. So interestingly, I deal with all the feedback from our programme that patients send us, and we send standard, you know, questionnaires out, and 99.9% of the patients are happy with absolutely everything. Has gone very, very well. The only one thing we ever get complaints about is the preparation. So if they could come up with a different way of giving you preparation, I think we'd have it spot on. Fortunately, it isn't a pleasant experience having to down that so-called lemon liquid that's no more lemon than Domestos is. You know, it's not very nice. But yeah, great question, Steph, because we really have got you know, if I just give you an idea of obviously the uptake across Greater Manchester hovers around the 65-68% mark. That's 30-odd% of patients who either choose not to engage in the screening programme or can't engage in the screening programme. And it's those can'ts that we need to make sure there's a way of them doing it.
That's really interesting. Thank you for sharing that. Ian, I would just like to ask, thank you for sharing your very powerful story. A few things that you mentioned, obviously, you talked about, you know, the thought of like, you know, you've noticed changes in your bowel habits, and you were a bit wary of talking to somebody about, you know, your changes. So we do know that there's this like genuine fear in society that people don't like to talk about cancer. They don't like to mention the C word because it's scary and it's frightening. And particularly among men, we know that men don't openly talk about the health issues as openly as women do. So what advice would you give to any a man or a woman who may be watching this, you know, who maybe have noticed something, you know, a bit different, not just within the bowel, but with any part of the body, and the woman that it could be cancer? What advice would you give to them to just talk to somebody? Because you said you were very lucky that you were diagnosed with stage 1, and obviously, you know, you went through a lot of emotions with that. And like, what advice would you give to anyone who's scared of approaching a doctor and talking about the word cancer or anything like that?
Well, I think the bottom line is when I do tell people about my experience, at the end of the day, what you have to do is go to the doctor, and you've got to tell the GP. And sometimes when people have said they don't like doing it, I've suggested that before you actually speak to the doctor, before you speak to the receptionist to get the appointment, you write down all the symptoms that you've been having over what time frame, so you're able to give the doctor as much information as you can. And it's one of those things, especially with the bowels. Sometimes you can be tempted to say, "Oh, I've just had an upset tummy," and that doesn't really explain anything about what's been happening. And you've got to be able to say that I've had diarrhea symptoms, or I've found it very difficult to go to the toilet, or to have a poo, and to actually just say it as it is. And when anybody asks me, that's why I always tell them what it was actually like for me, what it felt like, what it was that happened when I went to the toilet. And you're right about, well, in my experience, sometimes with men, sometimes we joke about those things, you know, about going to the toilet and having difficulty having a poo, or having diarrhea symptoms. You know, we kind of treat it sometimes as a joke, but very often when people hear, when I tell people my story, it's then that they start telling. Because some people have come up to me and said, "Oh, I've had something like that. What do you think I should do?" And the answer is always, go to the doctor. Just say it to the doctor. And that you've just got to do it, you know. And if they can tell me, or they can tell somebody else, then it just get them to get the guts to go to the doctors. But I think that's the bottom line. Go to your GP and tell them what's happening, but tell everything that's happening, even if you think it's not important.
Thank you, Ian. The final question would be to anyone on the panel, really. So, Ian, I know you mentioned, you know, like when you did a lot of research, you did a lot of Dr. Google, and we know a lot of people tend to do, you know, Dr. Google, and not everything that you read on the internet is reliable. It's quite a lot of scaremongering. So would there be any like websites or extra resources that anyone on the panel would recommend? And obviously my second part of the question was, because we're Healthwatch Bury, so we as Healthwatch Bury, we like to promote groups within the Bury area. So is there any group specific to Bury that anyone on the panel would recommend for people to go for extra support, to find extra resources, anything like that?
Okay, just to start this conversation off, you're right. When I went on Dr. Google, I was just putting in bowel cancer or, you know, anything and you do get lots of different sites. However, I learned really to restrict myself either to Bowel Cancer UK or Cancer Research or the NHS ones, and I found those to be full of information and the right advice, and it was up to date and things like that. So that's for me. I would pick those three: NHS, Bowel Cancer UK, and the Cancer Research.
Thank you.
So Alison is a cancer care coordinator, and she actually does cancer care reviews of patients as they're reaching sort of the 12-month mark after the diagnosis. So you're aware of some of the support groups in the Bury area, aren't you?
Yeah. There's quite a range out there for patients, and there's lots of resources available, and I always ask patients when I do reviews with them, make sure that they're up to date with the screening programs. They really are crucial to picking up any of those early signs. If I missed anything,
is the Bury Cancer Support Centre? Yeah,
there's Bury Cancer Support Centre, which is somewhere that I often refer my patients to, where they can get some support. They'll also have opportunities to relate and to talk to other patients as well who've received diagnosis.
We'll have a look anyway, and we can share some other links of other support groups. So we'll look into that, and then we'll obviously send a link afterwards. And we've got some translated bowel screening information, these videos on YouTube, which I will share as well afterwards.
Yeah, I was going to say actually the as Ian said, the .gov site, which is the NHS portal for health information, have lots and lots of resources. They have resources, as you say, in different languages, downloads. So that's both for the fit kit and also for the colonoscopy side of things. They have videos. They're able to send out. You're able to download and print off many different resources on there. Certainly Bowel Cancer UK, Cancer Research UK are always up to date with lots of information. That said, the age extension that I talked about is not really widely known at the moment, or widely advertised. The reason for that is that all of the programs across the country are going live at different times with the age reduction. So they're not making it a big public campaign at the moment. Just because they don't want to risk, obviously, someone assuming that their particular area is screened in a certain age range. There's British Sign Language videos, there's videos for patients with learning disabilities. There's an organisation called Beyond Words, which produce leaflets which are just pictorial only. There's no words in them at all, so they're really good for certain patients just to describe everything. I think the main message from me, and as I say, we can certainly share links. The main message for me is a much, as Ian was talking about, be aware of your bowel health and be aware of what is going on. Don't be afraid to talk about it. The main message is, if it's different for you, doesn't matter if your mate says, yeah, I always go twice a day, that's normal for me. If you don't, and all of a sudden you're starting to, that's different for you. And that goes with any part of your body. If something's different, go to the GP. That's what they're there for. But just in terms of health, a healthy bowel means a healthy body. And we can't stress that enough. Making sure that your vices are kept to a minimum, if you like. Making sure that you are eating fibre, you are eating a healthy food diet that isn't full of processed foods, isn't full of red meat, and just making sure that you're looking after your body. Your bowel and your microbiome of your body controls every other bit of your body. It's 70% of your immune system is actually in your bowel. If you've got a healthy bowel, you've got a healthy immune system. And that's the main key message from me, really, is just think about your bowel as being like the engine of your body, and you've got to keep it, the right oil going in and the right fuel going in to keep it moving. And really and truly, I'm not saying we've all got to be vegan, we've all got to be we've all got to eat so many vegetables a day, anything like that, but just be mindful that whatever you put in your body 2 or 3 days later is going to affect your bowel. And basically just look after it. You want this engine of yours to last a long time, so just be mindful. And with the greatest will in the world, bowel cancer screening, we want you to do the uptake, we want you to do the fit kit, so we know that you're well. If you do end up coming through to the units, to the endoscopy units, and having a colonoscopy, we will look after you to the best of our ability, and we will send you on your way at the end of it. And with the nicest will in the world, we don't want to see you again. And that's purely because we want you to look after yourself. And when you get that fit kit 2 years time, we want it to be showing that you're really looking after yourself. You deserve it.
That's really useful information. Thank you for sharing it. And thank you for everyone who shared the information on today's session. I really hope it encourages our viewers here at Healthwatch Bury to take up the bowel cancer screening, because screening can save a life, really. So thank you again for sharing vital information with us this afternoon.
You're welcome.
Yeah, thank you very much, guys.
Great. Thanks, Steph. Thanks, everyone.
Thank you. We'll see you soon. Thanks.
Bye.
Bye.